Rachel Haynes here from CTV National News. Thank you for the update on monkeypox, but my questions are actually related to COVID-19 and our current mandates that are in place right now. And my question to you is, do you think that there still needs to be vaccine mandates in place for travel in Canada?
Well, as I've said before, I think the relevant ministers are looking at those mandates as we speak. We are providing information to support their decision-making. And I think I would ask that you go back to the relevant departments on their decision-making process.
Follow up, Rachel?
Thank you, Doctor. But I would love to know a little bit more about this information and advice that you're providing to these relevant ministers. As Canada's Chief Public Health Officer, is there a justification for keeping vaccine mandates in place? Or can you tell us what is the advice, the public health advice that you are giving to these ministers?
Well, I think first of all, I would want to remind everyone that the people in Canada have done extremely well in, I think, taking up vaccinations. The vaccine mandates or requirements, as they were enacted late last year, were implemented at a time when this was pre-Omicron, where the Delta variant was escalating with some serious signs of serious outcomes. And I think at that time, there was a very good vaccine effectiveness against both infection and therefore likely transmission and against serious outcomes. When Omicron emerged, I think that changed the landscape for COVID-19. That is to say that we're very grateful that the vaccines are still very effective against serious outcomes, particularly after a booster. And that third dose is actually important, but it still works really well. I think what the data being examined is the vaccine effectiveness against infection and potential risk to people in workplaces and in the travel corridor. And so the data has been presented, and I just want to clarify that 2 doses is not enough to provide vaccine effectiveness against Omicron infection, and because the immunity wanes after about over time, and certainly by 6 months. So you need a booster or a third dose rather to be to bring that immunity back up. And the vaccine effectiveness against infection is modest, but it's not nothing. I think that's something that people have to bear in mind. It's around, depending on the study, it's around 50-60% if you get boosted, and it will wane over time, and we're just monitoring that at the moment. So all of that scientific information is taken into account, but that's not the only consideration that the relevant employers or the ministers have to take into account. And given that vaccines are imperfect, though still provide some protection against infection and transmission to others, there are layers of protection that are still needed, such as masking. So they can't just make one singular decision. They have to look at the suite of protective measures to keep employees, workplaces, and the travel corridor as safe as we can. The other advice I think we give is pertaining to the domestic and global epidemiology. And right now we are on a better trajectory in terms of the cases and hospitalizations, but many hospitals still have a lot of patients with COVID, and we are still experiencing quite a number of deaths per day. So it's still very much with us, the pandemic, but we are in a better state in terms of epidemiology. And globally, I think it's unpredictable. The global trend is down in terms of epidemiology, in terms of the cases, and that's great. But as you can see, other variants are emerging. The situation can change, and we need to prepare for sure towards the fall and winter period. So it's not an easy decision to make, but I think those are the relevant kind of data that it can be provided, including also the coverage right now for the booster dose. They'll take all of that into account as they're making their decisions.